You're watching the Wellness Hour Live. I'm Randy Alvarez. We're talking about fat grafting to the face to make you look years younger and to remove some of the fine lines and wrinkles. With us, we have board-certified plastic surgeon known all over the world, Dr. Neal Handel. Dr. Handel?
It's a pleasure to be here.
Now, you are known all over the world. I didn't just say that.
I am absolutely known.
Well, you
in a good way, I think.
Yeah, but by a lot of plastic surgeons know
yes,
who
I am.
you are.
I am. I've been very fortunate to have a great academic career. I'm frequently invited to speak at symposia. I just spoke recently at St. Petersburg, Russia.
Oh, nice.
I've spoken in Australia, New Zealand, all over Europe, South America, done live surgery throughout the United States, and at meetings abroad in Korea recently.
You do surgery in front of audiences?
Yeah, actually go to the university hospital and surrounded by about 40 Korean residents, nurses, and assistants. It's hard to get close to the patient. Cameras everywhere. And we do live surgery, and then it's broadcast to an audience. Recently, I did the Baker Gordon Cosmetic Surgery Symposium in Miami, probably the most prestigious and one of the best known live surgery meetings in the world. And there's about 600 plastic surgeons from all over the world in the audience, and the surgery is broadcast live. So it's very exciting.
Okay, good. So let's talk about fat grafting.
Okay.
I guess this is we're talking about using your own fat?
Yeah, we're talking.
Putting it in.
What fat grafting is all about, it's a pretty simple proposition. Take fat that you don't need from somewhere and place it somewhere that you do need it. And in the introduction, you mentioned fat grafting in the face, and that's probably the first part of the body where it really took off, but we now use it all over the body.
Really? Like
yeah,
where?
Absolutely. Well, let's talk a little bit about the face. Plastic surgeons came to the realization over the last 15 or 20 years that aging changes in the face aren't all related to laxity of the skin and drooping of the face. That's part of it.
Okay.
But a big part of it is loss of volume. And it's easy for anyone to prove this to themselves. Look at your children or your grandchildren or young teenagers. They've all got round, full faces, full eyelid areas, and they look youthful because the soft tissue envelope of their face is filled with fat. So if you look at younger people, children, adolescents, teenagers, their faces are round and full. The eyelid area is round and full. When you look at older people, senior citizens, often you'll see that there's a lot of atrophy or loss of tissue, thin face, thin neck, hollowing out around the eyes. This is very characteristic of aging patients, that kind of skeletonized look. So plastic surgeons began to realize that, you know what, aging just isn't laxity of skin, it's loss of fat. And some innovative plastic surgeons began to harvest fat from areas where patients don't need it, you know, the hips, the abdomen, the thighs.
Under the eyes mostly?
And inject it into all over the face. We inject fat into the forehead. A couple of weeks ago, I had a woman only in her mid-40s who had a lot of atrophy or loss of tissue in the temple area. We filled it out with her own fat. Looks fantastic. We do the area under the eyes with tiny amounts of fat. We do these nasolabial folds. We do the marionette lines. We can do the chin, the jawline. We can inject all the areas of the face. It's often done in conjunction with a surgical procedure, with a lifting procedure, but it can be done independently. Sometimes patients will just have fat grafting of the
Is it true that about 30% of it doesn't take?
It's true that some percentage of it doesn't take. It's hard to put a precise number on it. From the studies that have been done, we know that it's rare for 100% of the fat to take, so we do try to overcorrect a little bit. But depending on patients' individual characteristics, anywhere from 20 to 80% of the fat takes. Obviously, the surgeon has to do the procedure correctly. But it's not difficult. Most plastic surgeons who are trained in this do it correctly. And
is it also true, though, that you are seeing that by putting fat injections, their own fat, that the skin gets better?
Oh, absolutely. That's
like that there's stem cells in there, or
that's a whole other aspect.
Like you're growing more fat or something.
Fat is one of the tissues in the body that has a high percentage of stem cells. And so when we do the fat grafting, a large proportion of the cells that are transplanted are stem cells. And while more scientific investigation needs to be done on this topic to prove it, there are many surgeons who believe that it actually improves the quality of the skin.
Do you believe that?
Yes,
I mean, do you
I'll
see
tell you
it?
why. Here's the area where I've seen it. And as you know, I do a lot of breast surgery, and I do a lot of difficult reconstructive breast surgery in patients who've had terrible problems. Some of them have had severe radiation damage to their breast skin, so that it's leathery, it's scarred, it's discolored, it's adherent to the ribs, and you just can't put a breast implant in. The tissue would never tolerate having a foreign body placed behind it.
Okay.
In some of these women, I've done 2, sometimes 3 separated sessions of fat grafting, where we'll inject anywhere from 20 to 30 to 40 cc's of fat into that area prior to inserting the breast implant. And I have seen amazing changes in the quality and characteristics of the skin so that it can now accommodate an implant and give a good result.
Okay.
So fat grafting is useful in the face, it's useful in the breast, it's even useful in areas where patients have had excessive liposuction performed. And I have an example of
Like when they have dents.
Irregularities and indentations, exactly. And I saw somebody just a month or two ago who had had liposuction performed by another doctor in the inner thigh area, and she was distraught about the appearance of inner thighs. I mean, this is a woman who has a great figure. She's very, very pretty. Her inner thighs looked like there were multiple shark bites out of them. I mean, just this irregular contour. I grafted 80 cc's of fat on one side and 90 cc's of fat on the other, and she looks amazing right now. Now, she's only about 4 weeks post-op. You know, I've given her all the warnings. It may not last. We may need to repeat it, but it is an enormous improvement, and I'm confident that she's going to have a tremendous improvement. So you like it better than like Restylane or Juvederm or these other facial fillers?
And we only have a couple of minutes.
Okay, well, here's the issue on liking it better. I do like it better when it's appropriate to use it for a number of reasons. One is fat is your own tissue. It's not a foreign body. You can't reject it. You can't be allergic to it, and it's unlikely for it to get infected because it's your own tissue. So it's got that merit. Two, fat, once it takes, has a chance of being permanent. I have patients that are friends of mine who I did fat grafting on 20 years ago, into their nasolabial folds, into areas of their face.
It's still there.
I still see these guys, you know, out at dinner and stuff, and they go, wow, you know, my fat's lasted all these years. And I go, you know what, Dennis, you're right. You don't need it again. So there's a chance that it can be very, very long lasting. And the third, and this is an important point, the other filler materials work, but they're very expensive. Typically, 1 cc of Juvederm or Restylane or Radius costs in the neighborhood of $500 or $600. Now, I just told you that I put 90 cc's of filler on the inner thigh of my patient on each side, so that's 180. 180 times 500 is something like, if my math is right, $9,000 worth of just the filler material. It's just not practical, you know. Whereas your fat is free.
And the fat, I mean, for the fat that stays, just like fat on your body, it doesn't
Permanent.
go away. I mean,
No,
you have those fat cells.
Permanent, right?
Okay.
It's like when somebody has a hair transplant. It's permanent. Once the cell's taken or living, they stay there.
Okay, now we're out of time, but I have to, and this is a big question. Okay, here we go. Your buddy, one of your buddies, Dr. Greg Keller.
Yes.
And he's explained to me, and he's, you know, he does some filling and things like that, but that this loss of volume, the fat may not be, unless I'm not understanding him correctly, that the fat is not leaving the face, loss of volume, it's dropping.
That is a
and so now you're putting fat on top of that heavy part. You have an odd look sometimes, and why not just pick up the mid face, the fat pads underneath?
That is another approach. I don't disagree with him at all.
You do a mid facelift, by the way?
Yes.
In your hair? Okay.
Yeah, we do mid facelifts. We're talking about fat as an adjunct to lifting.
Okay.
If you go back to the beginning of our conversation, plastic surgeons haven't abandoned doing facelifts. In fact, they've refined them and made them better and better with cheek lifts and forehead lifts and endotines and all kinds of other things. But in addition, we've added fat grafting in.
So if you're going to, and we want the takeaway message here, that we always say news that makes you healthier, but for people that have lost volume, that consider
fat grafting as a part of the procedure.
But there's technique to this.
Absolutely.
So you better go to somebody that, because a lot of guys don't do it, by the way. They poo-poo it.
A lot of people don't do it.
They go, it's expensive, Randy, it takes a long time, it doesn't
it
last.
takes time and it takes attention to detail to do it right, but it's indisputable that it works. It's indisputable that it lasts, and there's no doubt that the improvement can be dramatic.
Yeah.
And I think it's an excellent technique. Again, these things have to each be individualized.
I've seen it, by the way. I try not to. I'm not endorsing you because I haven't seen your under the eye fat grafting. But one of my buddies in Palm Desert, one of my personal friends who's a medical doctor, pain management, he did it under her eyes. She looked, I mean, because the eyes show the fatigue.
Right.
Fat. And this guy,
that's right. The first
phenomenal.
part of your body to show aging, periorbital area.
And she looks so natural. Yeah. And
the eyelids
she's a 1 year out. I couldn't believe it.
The eyelids are a tricky area. It has to be done very carefully.
Hers were under her.
I understand, but sometimes we do hollowing of the cheek, the submalar area, the temporal area, the lower eyelid area, all these areas.
Let me throw in one more thing.
Yeah.
Because I think the public needs to know this, that many guys will just put a list of everything that they can do, right? But they have very little experience in doing them. And so fat grafting may be on somebody's list, but they do it very little.
I think it's the same with any procedure that a patient
So ask
is
your
looking to
doctor
have.
how often you do it.
How
or
long have
many-
you been doing it? How many cases do you do? Can I see before and after pictures? Maybe even, can I talk to patients that you've done this to? Make
And,
sure he's had experience. There's no substitute for experience and good clinical judgment. And that
you're
just
one of the
comes
most
with time.
experienced guys probably
That's a
in the
nice
world.
way of saying I'm one of the oldest guys
Yeah,
in the
yeah,
world.
but you're one of the most experienced guys because you're busy, right? But
I'm
here's-
busy and I've been
but
around
when
a lot
was
of
the
years.
But when was the last time somebody went to asked you, doctor, how many facelifts have you done, or doctor, how many of the?
Well,
I bet they don't ask
they do occasionally, and they should ask.
Like once every other month?
Well, probably in that neighborhood. But I think that when they see that
intimidating.
you are very knowledgeable about their problem, I think the confidence that the physician has when he explains the procedure and his reasoning about why.
okay.
I've had a lot of patients say to me, you know what, I can just tell from talking to you that you're the guy I want to go to. You understand the problem better than the last three guys
but I think
that
you
I
should
talked
ask
to.
how many they have done.
I do think so.
Somebody called me and
Yeah,
said, a
I
friend of
think
mine,
so.
they're going to get nasal surgery. I said, you better ask how many
Right.
nose jobs they've done and how often they do them.
Correct.
Because I've been told it's a very tricky procedure. You have to do right the first time, oftentimes.
It's much better if you do.
And you know what she said to me? There's no way. That's insulting.
No, it shouldn't
Because
be
it is
insulting.
intimidating.
No, it's a question that should be asked and answered.
Good. So they asked that, and the doctor should not get offended.
Absolutely.
And if he is offended or she's offended, probably not the right doctor for you.
I would agree. I would agree.
So you're not
obviously,
offended when they say
I'm not
doctor?
offended. But, I've been in practice for 35 years. I think it's a more difficult question for a brand new guy in practice to answer.
Oh, yeah.
But there are brand new guys in practice who are excellent. They need to explain what their training was and that they did it in residency and that they trained with excellent rhinoplastic surgeons and that they feel very confident in their abilities. There are some excellent young plastic surgeons. But on balance, the more experience somebody's had, it's like driving a car or driving a golf ball.
But with fat grafting under the eyes, that's a delicate area.
That's a very delicate area.
I mean, you're going to be looking at your face for a long time.
Well, that's an area that's much more prone to complications than other areas of fat grafting.
So go to somebody with
Because
experience,
the skin
especially.
is so thin. Yeah, we have to be very careful and do very tiny, judicious amounts of grafting in the under eyelid area.
Well, Dr. Handel, always a pleasure.
I
to have
enjoyed
you
it.
on the
Thank
show.
you.
We always learn something every time
Thank
you have
you
on
so
the
much.
show. So we'll have to have you back.
Thank
Talk
you.
about
I
some other
appreciate
things.
that.
Thanks
It's been
again.
fun. Great.
You've been watching The Wellness Hour Live. I'm Randy Alvarez. We'll be right back.